sorry again for the interruption. We'll have to start. I'll have to do the introduction again to everybody. Sorry for all those who've been waiting with us on Facebook for the Malawi Diaspora Network Diaspora Discussion Series. This is our second one. Here with Maziko Matemba, who's a health activist and National Community Health Ambassador, COVID-19 analyst for Malawi. And Ken Malomboza is with the Malawi Community USA. And I'm sorry, I'm gonna have to do it to you guys again, but briefly, Maziko, if you could just tell us your brief, who you are, and also what do you do as a health ambassador? That's an interesting title. So if you could unmute yourself, you're on mute at the present time.
Thanks so much, Mwzia, Ken, and Stinga, and everyone who has joined us on Facebook Live. Welcome to Malawi. How are you in the US? And I know you're on a lockdown. Malawi, we just have restrictions. We don't have lockdown. But anyway, as Mwzia has mentioned, Maziko Matemba. I'm from Malawi. I'm based in Blantyre. I'm a health activist, but also I'm a community health ambassador. This is my role, the new role which I attained last year in November. Basically, I'm the ambassador for the community health workers, but also the community. So basically, I'm also an executive director for an organization called Health and Rights Education Program, but also I'm the board chairperson of HIV network, Manaso, but also I'm the vice chairperson of the Malawi Global Fund Committee. This is the Global Fund Coordinating Committee in Malawi, so I'm the vice chairperson. So basically, those are some of my few titles. Mm-hmm. Basically in Malawi, I fight for the rights of health rights of people in Malawi at different levels, communities, but also health workers, to make sure that they're able to have the highest standard of health services in the country.
So we're gonna go to. I just wanted to, before we go on, I wanted to have Ken brought into the discussion. Ken Malomboza, who's talking to us directly from the central part of the United States in, people call it Michiana, Michigan, Indiana area. So Ken, if you could tell us who you are and what brought you to here today.
Good evening, everybody. I'm live from Indianapolis. So Michiana area, a little bit further, about 2 hours away from Michiana, but same thing. So I'm with Malawi Community USA. I'm the co-chair. The other chair is Felix Lindeile, who is not here. So I'm here to represent him. This is the umbrella body for pretty much all the other organizations that are Malawi best. So we were founded about 7 years ago. So we're still in operation, but I'm also a member on board with Malawi Diaspora Network and a subcommittee with the Malawi Investment Fund. That's something else that's in works because it needs a lot of work, but that's a brief message. Most of my friends from here and even around the world know me as a commissioner because I'm the guy that connects people. So a lot of people are my friends and I make sure we all stay in touch. So that's a brief, you'll learn more about me as we go on with the conversation, but thank you, Maziko, for taking your time. We're very appreciative for you to be here. We know it's late back home, but it shows how committed and how serious you take your job. So we're very grateful and we're looking forward to have this conversation with you. And thank you, Mwzia, for hosting this series event.
Thank you. No, yes. Thank you. And also want to thank also the listeners and viewers for sitting up, waiting as we wind out some of the details early on. But as we were talking about COVID-19 in Malawi. So Maziko, if you could just give us a brief lay of the land, so to speak. What is the current situation? Of course, so far we haven't seen as many cases, but if you could tell us in context, what are the number of cases, fatalities in particular, and then we can talk about the other issues as well as we go on. But briefly, if you could talk to us about the
Thank
cases.
you so much. Thank you. Thank you so much, Mwzia. Indeed, Malawi is not spared with COVID, even though Malawi came late, with a late in the Southern Africa. As you remember, there was Lesotho and Malawi, which didn't have a case until in April. So Malawi have had these first 3 cases on the 2nd of April. And from the 2nd of April, as I'm talking now, from yesterday, we have 70 cases. Of these 70 cases, we have three mortalities. We have lost 3 people with COVID, and we have 40 active cases. And of these 70 cases, 25 cases are imported, meaning they're coming from outside Malawi. Most especially, I think the current hotspot is Tanzania. And also, sadly, we have 42 local transmission. At the beginning, we didn't have local transmission. So we have 42 cases which are transmitted in country, which we wanted to be avoided. But I think I will explain later why we are now, the local transmission is increasing by the day. And 3 cases are still under investigation, just to verify whether they have COVID or not. And in terms of gender of these cases, which I've mentioned, 37 are males and 33 are females. And we have 27 recoveries. About 27 people have recovered. And currently, as mentioned earlier, we have local transmission. 11 districts are affected. As you know, Malawi has about 29 districts. So 11 districts are affected. So far, we're not doing much in terms of testing. We have tested so far about 1,803 tests conducted in the country. And this is not a good sign. We're expecting to have more tests. That's why maybe the figures which you have, maybe we might have more cases, but maybe we're not testing much, and we can discuss later because we need more work on that. And currently, we have 11 testing sites. At the beginning in April, we had about 3 testing sites, but as of yesterday, we have 11 testing sites. Blantyre has about 2 testing sites. Zuzu has 1, Ilonga has 1, and we have other testing sites in other districts. But we're still lobbying and advocating that we have at least each and every district need to have a testing sites, which you don't have at the moment because of so many reasons. As you know, as already shared, when Malawi was declared a COVID country, that time we didn't have much more support. And this also led into Malawi not having much of this. But I think at the moment, government is trying to come up with more testing sites. But with the lockdowns in other countries, I think we're still struggling to have more people tested. So those are briefly what we are at the moment. Another issue which I just want to share briefly as well, as a country, we have the Malawi COVID-19 plan, which was launched in March. So on the plan, that's what we are doing several activities and make sure that things are well coordinated in the country. So in the COVID plan, there is a lot of actions which different stakeholders need to play to make sure that we're able to contain the corona virus. So in brief, that's what we are as the country. Thank you.
And of course, you were just watching and listening to Maziko Matemba, who's a health activist and national community health ambassador and COVID-19 analyst for Malawi. And you're watching the Malawi Diaspora Network Diaspora Discussions. I'm Mwzia Munthali, and also with me is Ken Malomboza of Malawi Community USA. And I'm with Malawi Association of Washington. We were together part of the Malawi Diaspora Network. And if you could, before I go to Ken, briefly touch on the figures being low. I think one of the people, one of the worrisome things that people have is that the number of the incidence of COVID-19 is low. And then you touched on the fact that it's probably due to the fact of not that many people have been tested, or people who might have it have not gone to identify themselves. So how serious a gap in information is that for the country in terms of not knowing the number of people?
Indeed, I think as a country, we're still grappling in terms of reaching out to cases. As you already said, we didn't have much testing sites, but also we haven't tested much, because since April, we've only tested 1,803. That's why we are lobbying. And currently, as you know, Malawi is going through a political presidential rerun. And with that rerun, we have seen so many people are not observing the basic COVID regulations, restrictions. And we were supposed to have a lockdown, but the matter is in court, and the court did grant government to do lockdown because government did come with a clear plan in terms of social protection. So we people are still moving. We don't have much strict restrictions in terms of movement. That's why I'm saying that the 70 cases might be maybe just a small figure, but if we can do mass testing, we can find out that maybe we might have more cases than what we are seeing on paper. So that's an area which I think as Malawi, we need to work so hard. But also in terms of resources, we have, even though we have the COVID plan, which was budgeted about more than 100 billion Malawi kwacha, what I got less than 15 billion has been contributed so far by partners and government. Which is not enough because there are some areas which I think are not yet supported yet. But also Malawi being a landlocked country with other countries, bigger countries like South Africa, I think Kenya, but also Ethiopia. These are routes, going to Malawi. We still have problems in terms of receiving commodities and other important things from outside. So with those things in place, we can see that we're still grappling. But also I need to share that, as you know, our cases started early April with 3 cases. And you know, with the period, the 14 period for COVID in terms of how COVID
14-day period
manifests itself. Yes. So we are still, now we are maybe in the 4th week by now, and we're also going to June, July period where most people suffer these respiratory conditions. So that's why I'm saying we would expect to have being in a peak period. So the figures might be as not what it is. There might be more cases also, as I highlighted earlier, with the political campaign taking place. We might have more areas, but I think maybe we're not doing much of testing.
Okay.
But also we don't have supplies. So yeah, so we are at a crossroads, which we need to work so hard, make sure that more people are tested. But also another issue which I wanted to share.
Oh, sorry, I also wanted to bring in Ken when you talked about supplies.
Okay, thank you, Mwzia. I'll come back. Thank you.
I wanted to bring when you talked about supplies, it sparked my head about to Ken and what other things. How does where does as you hear all this, where does the diaspora come in as you hear all these issues from the ground? Talking about the testing and the lack of supplies and issues. What is the diaspora's role?
That's a very good question. To me, that question is very broad. I always say this: we have a bigger upper hand as far as reaching to our brothers and sisters back home. We have maybe the biggest presence on social network, and I think even simple messages, the ones that we share on WhatsApp, we have to be very responsible, because I remember at the beginning of this, people were saying Black people don't get infected, Malawi does not have this. So a lot of people were legless because of silly forward messages which do not have a very good information to the people. So as you asked the question, I said we have a very big responsibility. So this is where we come in as Malawi community, not Malawi community, you say as Malawi Diaspora Network. At the moment, everybody else, if you can hear me on Facebook or you're on Facebook, you can go on that Malawi Diaspora Network Facebook, you find information that we are doing a fundraiser on GoFundMe. And this is to get equipment back home. I always say the little that you do can put much impact, so anything that you could do to help will be greatly appreciated. And for Maziko, I think you touched a very good point. Right now, without saying and not trying to get too political, we are kind of a divided country as far as ideologies. How do you bring up these two groups that are divided on leadership without stepping on people's toes, because we work with the embassy of Malawi.
Yes.
Some people misinterpret that, think that maybe we are working for the ruling government, but the embassy represents us as a whole. The ambassador is our representative and is a he's here for us, regardless whether people think whoever he belongs to, but we have to work with government.
Mm-hmm.
We as citizens are government. What would you advise would be the right way of channeling this information to people without people thinking that, you know, you belong to a certain party, or, you know, how we think as a people? That's a very difficult task.
Yeah. Indeed, I think, Ken, we have raised a very important issue, being, I think, we're a divided nation indeed, because you know what happened. I think everybody knows, even diaspora, the presidential election, which was nullified by the courts. And with that, they highlighted that we need to have an election. So from us as an activist, we're not taking any part in a political line of people who are aspiring to be president of the country. We have avoided as much as possible, and more especially reaching out to the people at community level. I myself personally have traveled across. Only 3 days ago, I was in Kalonga and in Mzuzu. There were some issues there, but also I've been to districts like Kinsanje, Cholo, Zomba, and Mulanje, just to check how prepared communities are to support the COVID response. When you go to the communities, people are not talking politics. But when you come to urban, that's when you see the actual politics being mentioned. In the next couple of weeks, we are trying to reach out to all political parties. I had discussion with the UN. They're also supportive that we reach out to them, more especially now they're doing rallies, the political rallies. Even today, I was disappointed. Even last week, I was disappointed. I even made a statement to say, if we continue doing the way we are doing the rallies, in terms of not observing social distancing and other COVID measures, I think we might see a lot of cases of COVID. But I think the way we need to do it is, as Ken, you have asked, I think is try not to be political, and try not to be political. Everyone has got his own political favorite. And you cannot, it's a right anyway. So I think the most important thing is, I think let's do the needful by reminding them. And the best way to do it, since most of the political parties have got chapters in diaspora, all the major political parties, the MCP, UTM, Alliance, they have got chapters. The DPP, UDF has got chapters, and even the Mbakwaku. Those are 3 parties now who are contesting for the presidential. So what you need to do, I think, maybe take them, just invite them on the round table. That's what we want to do in the couple of next weeks, to put them on the table, have a candid discussion. And when I was in Mzuzu, I had a discussion with some of the local people, they are leaders in Mzuzu, who are willing to discuss, more especially when they're conducting their rallies. Because now it's almost difficult to stop them from doing the rallies, because everyone wants to go for an election. So it'll be very difficult to say, you stop. I think it'll be very problematic, because we are leaving that decision to the leaders, the presidents of these 3 parties, to sit down and agree if indeed we need to have an election, which is very political. If they agree, then it's easier for the supporters to follow through. But I haven't heard any statement from all the 3 political leaders talking about whether to think through on how best they can avoid or prevent COVID. So it's an issue which I think it belongs to the 3 political leaders to sit down, agree, disagree, so that we can prevent. But on our side, since we are not political, the diaspora is not political, I am not political, communities are not political. I think the best way is how best can we do in terms of preventing from COVID? Because as you know, COVID, we don't have any vaccine or medication so far. So I think the best way is, for example, if the rallies are taking place, how do we make sure that the people who are organizing rallies, they adhere to COVID messages? But also we are trying to make sure that any presidential candidate, when they're doing their rallies, at least they need to say something to speak about COVID, so that their supporters can follow through. Because at the current moment, the supporters are listening to their leaders. So that would be the easier way. So from diaspora, since you have chapters, you can also do likewise, reminding them, even writing on social media. I haven't really seen much in terms of writing on social media to say, hey, I support this political party. Could you please make sure you're not doing good in terms of social distancing. You're not doing good of other measures. I think you can also help us from that side because people also listen to you a lot to say, please, can you make sure we still need election? Yes, we still need election, but could you please make sure that after election, we don't want to see a lot of people affected or infected with COVID-19. It would be catastrophic because our system is to have challenges, big challenges, in fact. For example, I'll give you an example. I'll just give an example. Mwzia, before we come, I'll just give one example. We don't have much isolation and quarantine centers. Just what I can say. You know, we live in a communal system in a village. We're still living that life. So in brief, that's what I want to say. Thank you, Mwzia.
Oh, yeah, that's very, and thank you very much for letting us know about the initiative that you're trying to put together, uniting people and bringing health at the forefront of the issues. Even though you can be political, but you can also health is an important. It's actually a human right. It should be a human right, but unfortunately, it's always given a back burner until there's a crisis like now. Then we start remembering health. But I wanted to expand this thing on the diaspora. And Ken, if you can expand a bit more of what the campaign is all about on the GoFundMe, expand on it. And then I'd like to also ask later on Maziko's input on that campaign. So if you could tell us what that campaign is exactly.
Yes. Again, everybody else that's on Facebook, you can actually go on that page that you're watching us live. You find all the information, or you can contact us, me and Mwzia, on the flyer. And I know I have my friends that are on IG, and unfortunately we couldn't get you there. But we have, at the moment, we have put up 15,000 as our goal. And we've been talking to other partners in the campaign that are back home to see exactly where we could make more impact as far as resources. So all the information, we're still gathering information. Right now, Mwzia, I think the update, we're at 4,500. Am I correct?
Yeah, no, we're over 4,500, close to 4,700.
4,700?
Close, yeah, close to that. It's 4, yeah.
Yes, and I think we're on the right track. And we would like to ask everybody, tell your friends and your friends, join us. We've seen our brothers yesterday. They did a great job. And I think they will join us on our cause too. But what we're doing is just a social responsibility on our end to say, I always say this, to whom much is given, much is required. And I think us being here, I think we are blessed and we have enough resources that we can share with our brothers and sisters. And I understand how hard it is back home, because I mean, I think it's very unfair to think the systems or the policies that have been put here in America could be implemented back home in Malawi. We live in two different economies, and we have to be socially responsible. So the message has to be very strong, and we understand the two different worlds. And I know it's a challenge to say we should go on lockdown. I think that's hard. Here it's doable. You know, I mean, we all got a stimulus check on top of everything else. And I don't know. I mean, I don't know what the budget of Malawi is at the moment, so I'm not going to touch on that. But us as Malawi Diaspora Network, that's what we're doing. We've been sending messages. We are trying to get the fans. Again, go on this Facebook. And if you could give today, that would be nice. And I'll give, I already started giving most of my partners here. Everybody has gave, and we're going to put that, and you get more information as we go. But that's how we come in. And we've done other campaigns too. So COVID was one that was dear to our hearts, but we've done flood, we've done hunger, we've done other things. You can find all that information. But again, I'll pass it on to Mwzia, you know, for the interest of time, so we can get other things covered. But go on that Facebook.
And I think also to stress that campaign, that what they're trying to raise funds for is for the PPEs, personal protective equipment, PPEs for the healthcare workers. Just like you have the problem here in the US with healthcare workers don't have protection. What more the Malawi, which is underfunded, always struggling. even under normal circumstances, nurses and the doctors, all the healthcare providers don't have enough PPEs. So we decided that we'll try to raise funds for getting funds for personal protective equipment. So Maziko, if you could expand, tell us that that need. How big is that need on the ground in Malawi? If you could, especially you being in the health field for all these years, if you can expand so that when people ask us, when they say, why did you pick PPEs? If you can expand and let us know tell us exactly what that means in the Malawi context. Thank you so much,
Mwzia, and you have raised another important issue. Only 2 weeks ago, you remember, maybe you heard on social media that the health workers were on strike, and they were demanding the availability of PPEs. I was part of the discussion with the health workers, most especially I was at the Queen's River Central Hospital. Most of you who have been there in Malawi. Yeah, so we had discussion, and we reached to a conclusion that any health worker who's operating from now going onwards, they have to have a PP. Because most of them will not have PPs when we didn't have COVID. They were just using other things, other things. But now PP is a must. When we did an analysis like 2 weeks ago, because we had an consignment from JACMA, a Chinese-based donation, but it was only lasting for 3 weeks. By now, they might have, they don't have maybe PPs. So the PPs that are needed, like yesterday, that are needed, I can give you a more analysis of the gaps because I'm working with partners who are procurement, because it was one of the conditions which the health workers demanded, which was justifiable, and we also issued a statement to say we don't want to see our health workers infected with the COVID-19 just because they don't have a PP. So it is a condition now that any health worker who is operating in our facilities need to have a PP. So the demand for PP now has gone up than before. And with increasing of local transmission, as I shared earlier, that we have about 42 local transmission from about 11 districts. It means the COVID-19 is going now deep into districts, the things which we wanted to avoid. It means we also need to equip our local health facilities to have PPs, because most of the PPs were more concentrated on the central level and district level, but they were not going deep into the health center level. So the demand for PP is so high, like yesterday. I can give you the figures, the quantification. Let me discuss with other partners who are procuring those PPs. But also the other challenge which we have is the supply chain of PPs, because UNICEF is one of the major supplier on behalf of government and other partners, but they're having challenges in terms of where they get the supplies, because they said Malawi is on the queue. So in the US, if you have any opportunity, which I think the Malawi diaspora, you can also play a part, since some of you were working in some of those companies, or maybe you have got an influence out there. You can also lobby with your colleagues in other regions of the world, have a discussion and say, how do we make sure that we can make sure that we fasten the process of providing PPs in the country, because currently we don't have much. And I need to make another assessment, because they said in 2 weeks, they might run out of PPs. So now, by now, I think most of them might have shortages, a lot of shortages in the facilities. So that is an area which we need to do. But also, apart from PP, another area is test kits for COVID. We didn't have much. That's why we have only 11 facilities, testing centers who are providing testing and screening for COVID. It's another area so we also need to look into, apart from the PPs. I don't know how it's procured, but we're just watching on CNN and BBC on how also America is also struggling to find such. But I know maybe, so yeah. But I think with your connections as a citizen of this beautiful country, Malawi, you can also try to move that agenda. But also, I can make a commitment to the Malawi diaspora in the US that I can also have a discussion with people who are planning around the COVID, on if indeed maybe we can connect, and maybe I can give you an update at regular basis on what procurement we have what supply we have and the supply which we don't have. If you would have told me earlier, I could have prepared because I just have a few items which I highlighted. If you can allow me to say them, in terms of the procurement which we are looking for. We need the disinfectant so that we disinfect. We need surgical masks, disposable caps, even disposable shoe covers, goggles, face masks, heavy duty gloves, and
So
tents.
basically everything that's connected to PPEs.
Yes, connected to PP. So these are the needs which we had a meeting some weeks ago.
Yeah.
Where they highlighted they are not available in most of our facilities. So yeah, we are in need of these facilities. You can also play that law, talking with your companies and other well-wishers in the US who could be willing. I can connect to the people who are managing the response here so that we have a smooth and transparent process of procuring those.
Yeah, and we've been talking to the Association, Malawi Doctors Association. I think some of the members of the campaign have been talking to folks that you probably speak with as well. But I guess in short, you're saying just as much as we just need PPEs, period. There's there's just that's one key doable something that can be done immediately from the diaspora community. So I guess that really puts stressing to what Ken has been saying earlier on about go to the GoFundMe page as well, that the raising the funds for PPEs is critical. Ken, you're about to say something.
Yes. This is just to let everybody know. I know most of the people that are watching from North America, to say Malawi Community USA is for everybody. It does not belong to a few individuals. It's just something else that it got started, but there's a lot of things that you could help. Again, this is just one of those initiatives that Malawi Diaspora Network has taken on, but there are so many things that we as a diaspora, we have a lot of leverage. And I think we can lobby even with governments from back here and back home. But all we have to do, we have to show up. We have to be responsible citizens. So this is a vehicle that we could use to come together, to join together, to speak with one voice. Because if Mwzia speaks with another voice and I speak from a different platform, sometimes the message is lost. So to speak as one, I would just like to urge everybody that is in North America to come and join Malawi Diaspora Network. We need your expertise. We need everything that you can bring on the table. It's for everybody. Again, go on the GoFundMe. There's more information. You can contact us and see how you can come in. There's a lot of positions that needs to be filled. But we can start with this campaign from then on, and you can hear more and how you could help with Malawi Diaspora Network. But it's a very important organization, and I think we're on the right track. While we're at it, there's a lot of things that we're lobbying to, including dual citizenship, wink, wink. But yeah, so one of those things
which has been passed, by the way. They have passed it, and it's now law. But now pushing it further. Yeah,
I know it passed, but I'm just saying this is a vehicle for everybody. Everybody join, and when we do these things, we are being socially responsible for our citizens back home. And go on the GoFundMe and contact us. But I'll pass on to Maziko, Mwzia.
I just wanted to make sure people know how to find it on GoFundMe. That's MDN, which is Malawi Diaspora Network. And so if you search MDN COVID-19, you'll get it, or just put MDN and it pops up. It's like the first one. And it's MDN COVID-19 PPEs for healthcare workers in Malawi. That's MDN COVID-19 PPEs for healthcare workers in Malawi on GoFundMe. That's what you need to, if you're looking for, and that give you more information about the campaign, how people can support us from all over the world. This is not because it's the internet, so you can do it from anywhere.
Mwzia, can I get a few seconds in?
Go ahead.
Actually, we're trying to. There is a concert that's coming up at the end of the month.
That's right, exactly. Yeah.
We have DJs, we have local artists, and it's going to be something interesting, something of its kind. But I would like to say, keep looking from wherever you got this information, you get more information about the concert. And I think it's going to raise a lot of fans and a lot of awareness. So Malawi Diaspora Network is on top of it. We have members and our partners working in the background. And
Ken, as a teaser, where are some of the entertainers from? Just give us a little tease.
Some they're Malawians. One, I mean, we have a great name. Should I give it
Yeah,
up?
we know we shouldn't say the name, but
okay, but we have of course our local DJs from here from United States, and we have some. I'm feeling like I should mention, but I'm not going to mention his name.
Yeah, yeah.
So artists from here from the United States that people. He has a project out that you got to tune in.
Yeah, as I say, stay tuned. Stay tuned in.
And we have other artists that are going to play from Malawi. So we have poets.
And I'm just hearing that the link is pinned on the video as well. For the link of the I guess it's this is the link for the Facebook, for the GoFundMe. Yeah. Good. That's on the video as well, so people can check it out as well. Any before we go, I wanted to have Maziko and then you, Ken, as well, for last closing thoughts as well, so that people can we don't take too much time away from people who are doing so many things, getting ready for Monday. Even though they're in lockdown, they're still working from home. And I'm glad you mentioned that lockdown is, you can't have it in Africa. Really, it's a different type of, you can't really have the same type of lockdown as you have here. And I think one of the problems, I guess, before you say something, I think one of the problems I see is that sometimes we do things as a copy and paste from here, instead of looking at the realities on the ground. And then talking to people like yourselves, because there are people on the ground who know what's going on. And is that one of the biggest problems you see, that there's been too much of maybe copy and paste of what other places, especially what US is doing, and the rest of the northern hemisphere, the so-called North doing, instead of saying, okay, what are the realities in Malawi and how do we deal with it in our context? Instead of saying, okay, there's this type of lockdown in the US, so we follow that type of lockdown.
Well, I agree with you, Mwzia, and also Ken, and also people who are listening to us on the screen. There are other issues which are very difficult for Malawi to adapt from developing countries. One such is the lockdown, because Malawi live hand to mouth, and this is a reality, even in town, in urban. People wake up in the morning having nothing, and they come in the evening and buy something to eat, and the next morning they go out. And even Ken can agree with me, and also Mwzia, have been here. So that's the biggest challenge, which that's the reality. So if you have a complete lockdown, it means government need to have a package, a serious social package for its people to be given. But also within absence of IDs, we just introduced IDs like some 2 years ago, but some people don't have IDs. So for identification, to identify those people, those are some of the key things which were raised to the court when the court had an injunction on the issue. But also another reality, which I think in your countries, I can see you are sitting nicely on your beautiful chair with Ken, having coffee. When I went to Kalonga, that is a reality. And then when I went to Sanje, if you say self quarantine for 14 days, you have to be at home. A Malawian home at the village, you know what it is. There's one house without any room, people sleep in the same place. So if you say this guy has got COVID, it's a COVID patient, so he has to be in the house. It means you're going to infect everyone who's around you. Where in the US, you can sleep in your room, and no one comes in, and you can be cooking for yourself and waiting for 14 days until COVID goes or you recover. So those are some of the realities which we are seeing ourselves to say, hey, this is a problem. That's why I just want to add one other request from you, apart from the PP. We need to have our own quarantine centers, which are like, you can have maybe a place, maybe a building where the few people who have COVID, they can go there and be housed there. I was impressed with Cholo. I went to Cholo as well. In Cholo, I found that the district health office for Cholo had some odd buildings, which they changed them into big quarantine centers temporarily to keep some of the COVID patients. So that is how maybe we can also emulate from here in Malawi. But for us to have to tell a person to go back home for 14 days to self-quarantine, that's why you have heard some of the cases, some of the COVID patient infected the whole family because there's no such a facility at home, because we have to live together in communal system of living. So those are some of the realities where I think from the diaspora side, you can also lobby, because the US is a big economy. Practically in Malawi, that one cannot work. And you have even issued a statement. We have even told government to reconsider how best do you do self-quarantine. I think it doesn't work, even isolation. So we also need to seriously think on when we're moving forward, if the cases are increasing, we have to make sure that these are institutionalized, that they're quarantined in an institution, not at home. It's not possible. Even in Mzuzu, they also said the same thing, that even if you live in Kolokosa, Chitawira, you live in Zorozoro, houses are very small. And you cannot have someone who have a COVID in that establishment. You can easily infect others. So those are some of the realities which now we are seeing in the COVID response, apart from the lockdown, which we need a very serious social protection package, which can be given to the population, which is not an easy for government to provide. So we're just playing hard, that maybe our system had to be stronger. That's why I've been moving around to make sure that our health system is very strong to deal, or maybe to detect, more especially on contact tracing, so that everyone who are contacted a COVID case has to be tested, screened. That's why we are lobbying for more screening and testing sites. And we have a institutional quarantine. That is the best for Malawi, an easy way of controlling COVID. But the other areas, I think, would be problematic, but not losing sight of the election. Because the election, if not well handled, if you leave the way it is now, I can tell you, in the next month after election, we're going to see a lot of COVID patients, maybe even serious cases. So we are trying to avoid, and we are preaching this every day. And I will not sleep until I meet all the leaders in the political parties. I will discuss with them. They need to find another way. We don't want to stop them from campaigning, but they need to help us. We don't want people to be infected with COVID. So in short, that's what we are. Thank you, Mwzia.
Thanks. And briefly, Ken, do you have any closing remarks for people from the diaspora end?
Yes, I'd like to thank everybody that joined in. And I would like also to thank those that didn't join in. I know this series, they'll keep on going, and next week will be other hosts. And Maziko, I can't thank you enough. This was very, very important and very eloquent, well put together. And I'm sure maybe you can send us a little email with the things that a report on the things that you mentioned. Mm-hmm. And that would help us too to identify things that we really need. And again, thank you so much. I know you had to stay up. And on behalf of Malawi Community USA, I would like to thank everybody again and again and again. But go on that Facebook page, please donate. It's for you yourself. And Mwzia, thank you for hosting this.
No, thank you. Thank you.
And it feels good to be part of this social network that is very responsible and is doing something great. And I'm happy for myself and my family and everybody else. Those are my last words. God bless Malawi. Mulungu adalise Malawi all the time.
Thank you so much.
And I want to thank you. I want to thank Maziko Matemba for being with us, the health activist and national community health ambassador, and also COVID-19 analyst for Malawi, and also Ken Malomboza, who is with Malawi Community USA and that Malawi Diaspora Network, and which I'm part of. And I'm Mwzia Munthali. I'm with the Malawi Association in Washington, part of the Malawi Diaspora Network. And we have the campaign, again, to mention that the Malawi Diaspora Network COVID-19 PPEs for healthcare workers in Malawi is on GoFundMe. Again, that title is MDN COVID-19 PPEs for healthcare workers in Malawi. And Ken, your number is for people And I also give out my number because we have our numbers on the flyer.
Yes. My number is 574-323-4732. Again, my number is 574-323-4732. And my email is my name and my last name at Gmail. But you can also find me on Instagram as DJK_NO. So it's easy to find me, or just look up the commission on IG and you'll find me.
And my number is 301-300-1682, 301-300-1682. And my email is just my initials, mckmunthali@yahoo.com. mckmunthali@yahoo.com. You can also reach me on Facebook at mckmunthali. Sorry, not MCK, it's Mwzia CK Munthali. Yes. So it's Mwzia CK Munthali. There's another Mwzia Munthali, so I can't add shit. So it's Mwzia CK Munthali. I just wanted to thank everybody.
Thank you, Dr. Koza, Ziko, Mwzia. Thank you so much. Respect.
And everybody stay safe.
Stay
do
safe.
the right things. Yep.
Yes.
And follow all the what Maziko had prescribed. And so yeah, thanks again.
Thanks so much. Respect.
Respect.
Bye-bye. Good night.
Good night.